As a new patient at 180 Physical Therapy, you might have wondered why a lot of the things that conventional physical therapists do are not used here at 180. One of those treatment strategies that we get a lot of questions about is dry needling. Here's why we don't dry needle, and you will never be dry needled at 180 Physical Therapy. Because dry needling is bogus. At 180 Physical Therapy, we only use treatment strategies that are rooted in science, like anatomy, physiology, and biomechanics. That's why we went to school for 7 years to become doctors of physical therapy, so we could use science to help you recover and return from injury. If we look at the history of dry needling, it's not all that old, 10 to 15 years old. And if we look at why it came about, we understand that dry needling was invented by physical therapists for the purpose of battling the increased patients seeing acupuncturists. So physical therapists invented trigger points so they could say that they were doing something with needles different than the acupuncturists were doing, but still try to get all those patients back so they could make money off of people using bogus treatment strategies. So if you've been told by somebody that they felt fantastic after dry needling, that is 100% a placebo effect. The other thing to remember is our goal is not to help you feel better. We could do a lot of things that conventional physical therapists do. We could actually give you things to do at home that would keep you from going to see a physical therapist and help you feel better, but it would not help you return to normal function. So our goal here is to use science in order to return you to normal function as soon as we possibly can. And dry needling will never do that, which is why you don't have to worry about being dry needled when you come to 180 Physical Therapy.